Welcome to the Diverse Minds podcast, where we give you the tips, tools, and techniques you need to be a mentally healthy and inclusive leader. Each week, you'll hear about a variety of topics linked to mental health, wellbeing, and diversity that will enhance both your professional practice and personal wellbeing.
Welcome to the 279th episode of the award-winning Diverse Minds podcast, and it's Mental Health Awareness Week 2025. This year's theme, as set by the Mental Health Foundation, is community. Now, over the years, I've done lots of episodes on mental health, well-being, and the workplace. And don't forget, the podcast is now fortnightly. But if you're missing weekly content, you have 5 years worth of podcasts to reflect back on. And if you want my handy guide that lists the episodes with a clickable link, you can get it at bit.ly/DMPG23. So this Mental Health Awareness Week, as led by the Mental Health Foundation in the UK, is all about celebrating the ways that communities protect our mental health. But our communities in the UK are in danger due to recent cuts to welfare, been a disaster, the talk about disability benefits cut, and essentially the ability for communities to have spaces of safety, care, and support. Because we know that being part of a safe, positive community is vital for our mental health and well-being. And we do thrive when we have strong connections, particularly that are easily accessed to us in the vicinity, face-to-face connections, as well as virtual connections. When other people are supportive, communities remind us that we're not alone and can provide a sense of belonging, safety, support in difficult times, and it gives us a sense of purpose. And I think we definitely saw this in the lockdown 5 years ago. Now, community is quite a broad topic. And I remember when I was a student union officer, there was a particular individual who I won't name, but if anyone worked in Leeds in the early 2000s, and in fact, even now, this individual is still around talking about community and defining community and bringing it up at meetings. Now, it isn't that easy to define community, but for the purposes of this podcast, let's define a community as a group of people with a connecting factor. That could be location, job role, identity, shared values. It could be hobby, and this could be in a physical way, so physical location, or virtually. So as per the Mental Health Foundation website, they say being part of a safe, positive community is vital for everyone's mental health. Yet too many people in our society are isolated, cut off from their local support networks and mental health care, and simply struggling to cope. And over the last decade, and I would probably say 2 decades, our communities have been splintered. Public health measures have vanished, and the basic building blocks of good mental health, like affordable and quality housing or good wages, have been torn apart. More than 2 million people are now waiting for mental health support, with our health services clearly not coping with the rise. Now, further cuts to communities are endangering mental health and removing vital support from people across the country. We must not allow this to happen. We must tackle the causes of poor mental health, and our communities are at the forefront of this fight. And I've read that out because I think it's so beautifully put. I don't think I could have written it better myself, to be honest. Now, if we think about what's going on, and we need to take part in community in a really big way, and this is really important. And I think this year's Mental Health Awareness Week is absolutely vital for highlighting that. But if I go back to this idea of workplace community, and if you caught my episode about your workplace should not be a family, and instead I talk about a professional workplace community, well, actually, what do we mean by that? So for me, a workplace community is where a sense of belonging, trust, and unity is fostered among all employees, and therefore you have a positive and supportive work environment. And yes, you might be colleagues and you might be friends, but it is about having that professionalism, building connections, looking at purposes, what you're doing, why you're doing it in the workplace, working together for those common goals. And this, of course, leads to a more engaged and satisfied workforce. So we know that if this is happening, people have a sense of purpose and fulfillment. They know that what they're doing feeds into the overall bigger picture, and actually that bigger picture is enacted. It's not words on a website, it's not words on a lovely board as you enter the organization. And it's really about creating a culture that recognizes and celebrates individual achievements and enhances connectivity between employees and fosters that sense of accomplishment. We also know that you're going to get reduced stress and anxiety because, of course, if you have a connected workplace community, that means any kind of workplace related stress and anxiety is managed. And also, you know that you can rely on colleagues and managers for support, and that there's open communication with active listening and support there to help you find solutions to what's going on, or work is contributing in a positive way, not acting as a stressor. And if you want to know more about how to handle stressful thoughts, I have a blog on the Diverse Minds website, and that link is in the show notes. And of course, we can feel very lonely and very alone, and work has a very important part to play in ensuring that we have that community and that sense of belonging at work. So, if we don't have that in our personal lives quite in the same way, work is a real lifeline for people. So, it can help people combat feelings of isolation, especially if they're working hybrid or in remote locations, and meaningful connections with colleagues. Now, meaningful connections is not that everyone has to be your best friend, but there can be kindness, there can be support, because this contributes to a sense of belonging and reduced feelings of loneliness. And of course, we also know that we want to feel valued and we want to feel like we're doing good, or we're fulfilling our potential. And work is an essential part of this. So when we're able to do what we need to do and also recognized for this, this is increasing our confidence and our self-worth and our self-esteem. Now, some might argue it shouldn't be the case, but I think in reality, we know that it is. And actually, we need to get feedback when we try new things and reach our potential. Again, that doesn't mean that feedback is, oh my goodness, that was amazing, but well done for trying, not yet that growth mindset. Because a culture that celebrates successes and supports development and says to people, not yet, but try again, is really great for our self-image. And then finally, of course, our friend psychological safety. So do check out episode 245, where I talk about what is psychological safety at work. And that link again is in the show notes. But we know there's psychological safety. People feel able to have conversations that are perceived as difficult. People are able to express their views and not be treated badly. And there is a culture of minimal blame and more about collaboration and learning. So I really hope you're enjoying this episode of the podcast. And if you are enjoying my content and you want to keep up to date, then why not join my newsletter? When you join my mailing list, you'll receive my white paper on inclusive language and mental health. And that link is bit.ly/ILMHCK. Right. So how do we go about building a workplace community specifically with the aim of mental health? Now, of course, if we do these things, we know that when we do them for one area, as I always say, we are going to improve things across the board. But I'll give you my suggestions, particularly for community theme for Mental Health Awareness Week. So the first one is about leading by example from the top. Senior leaders should be mental health champions. So that could be through official training, or if they don't want to do that, then starting the discussions and giving people space and budget to do that. Creating safe environments, so that links back to psychological safety, and empowering staff to share their lived experience of mental ill health and recovery in the appropriate ways. And I also want to be mindful and say not forcing people, because there are many people who have experienced mental ill health and recovery and don't want to share, and that's completely understandable. But that if people do, they can do that, and they can do it in different ways. So it might be they speak at an event, maybe there's a blog, maybe you have a wall of 100 faces about mental ill health and recovery, including people that have supported friends and family with their mental ill health recovery. However it works for you, Vox Pops, podcasts, showcasing on your IT platforms. There's so many ways to do this now. So how might that work? Also, that emphasizing, and this has got to come from lots of different points in an organization, particularly big organizations, that mental well-being and health is everyone's responsibility. So it's about having not just conversations, but looking at policies and procedures, making sure they're straightforward, making sure that there is a very transparent way to talk about mental health and well-being without it being gossiped about. Now, that's much easier said than done, I think, but there are ways in which to do that. And I think this does have to be led by the people and culture team. Again, going back to policies and procedures, they should be written in plain English with inclusive language, not punitive language. So language changes. So being really clear that the language at the time that we've written this policy is appropriate. It might change. And of course, we will reflect and review that every 2 years or every 3 years, normally when policies are reviewed. But particularly sickness absence, phased return, any policies like that that might be related, directly connected to mental ill health and recovery need to be really positive in terms of language and tone. And add to that as well, reasonable adjustment passports and wellness action plans. Now, wellness action plans really should be for everyone, and they should really be about helping everyone to think about their mental health, but they can be enhanced for people who have experienced mental ill health and have recovered or in periods of recovery, are on their journey, and need a plan so people know how to support them and they can also communicate their needs. And the same with a reasonable adjustment passport. It's been more associated with physical disabilities, but it's absolutely not solely for that. And a reasonable adjustment passport or workplace adjustment passport is a place where you can list your adjustments, why you need them. It's owned by the member of staff with disability, disabled member of staff, and communicated with the line manager. And if someone changes roles or they move to a different job, they can take that passport with them. So again, it can be digitally or it can be physical or both. So that's a very important thing. And I think that really builds a workplace community that is encouraging and supportive rather than punitive and punishing. Then finally, resource mental health first aiders. So ensure that you have mental health first aiders, ensure that they can go on the training and they're given the time, but also signpost people, because when really they're proactive resources, because they're qualified signposters, they know how to have conversations, and it really does reduce those crisis situations. So you're building a community of people who have had training, who are experts, they can support one another in the role, and they can support staff in the role as well. Be part of programs that empower people to support mental health difficulties. So this could be having mental health charities as your charity of the year. This could be about partnering with your local third sector organizations that support mental health and raising money for them, having them in, signposting people to them and supporting them. So again, this is about building a community inside the workplace, but also outside the workplace. And we know that the third sector is going through an incredibly difficult time. So any money that can be raised from corporates and big organizations is, I think, a really great thing to do and builds that camaraderie. And then, of course, promoting your employee assistance program to staff continuously and reiterating that it is confidential and how confidentiality is maintained and managed. You have to also evaluate the effectiveness of the service received. So having those discussions, make sure that you've got a point of contact with the EAP that you're consistently talking to. So I'm guessing the account manager from your service provider of your employee assistance program, and ensuring that also they have specific cultural services so that staff from a variety of backgrounds who want to access counselling or any information can do so in a culturally appropriate and specific way. And then finally, on building a workplace community for mental health is don't be afraid to talk about suicide. Now, this feels overwhelming, but please remember that the stats in the UK are not going down, and every day they are around 16 suicides per day, which is a phenomenal amount. And every suicide is likely to impact about 120 people. So every year, thousands and thousands of people are being impacted by suicide. So do provide specific suicide awareness training, such as ASSIST or the Samaritan's course on managing suicidal conversations. I myself have done the ASSIST course. It was absolutely brilliant. And we do also cover it in the mental health first aid program. And promote helplines to destigmatize the topic and enable people to ask for help, and put those up quite broadly. And you might think about training a group of staff, maybe if you have mental health first aiders, to enhance their knowledge on suicide. So I think when we start to do these things, it's not a one and done, as you know, as I talk about, but businesses that do this are going to create a much better and stronger workplace community, and a workplace community that's fit for purpose to support mental health. Because community is a broad concept and it applies in the workplace and beyond. And when we get community at work right, it supports everyone's mental health and well-being. There's a lot workplaces can do to support mental health, and that's really vital right now when things are difficult for so many people, including supporting the third sector. Perceived hard topics are the ones we really need to be addressing, as avoiding them won't make them go away. So creating this positive community is not only beneficial for individual employees, but also it boosts morale, engagement, and retention across an organization. So if you're looking to foster a positive workplace culture and would like guidance on creating a workplace community to support mental health, Diverse Minds is here to help you. Please reach out to explore our training, consultancy, and coaching services. And you can get in touch by emailing me at Leyla, Leyla, @diverseminds.co.uk. And if you enjoyed today's show, please leave me a review on Spotify or Apple or wherever you listen to your podcast from. And I'd really love to hear from you as listeners. So you can leave me an anonymous voice note or with your name at SpeakPipe. And that link is bit.ly/SPKPDMP. And don't forget my TEDx talk, where I talk about the connection between culture, race, and mental health. And it's something you can watch in your break, as it's just 12 minutes long. And that link is bit.ly/TEDx Wolves, WOLVESLO. And I really hope you like it. It's a labour of love. So if you did enjoy it, please leave a positive comment on YouTube, share and like. And the resources for today's episode are the Mental Health Foundation, with resources on how you can get involved, with the week, my blog on how to handle stressful thoughts, and episode 245 on what is psychological safety. So everyone, I really hope you've enjoyed today's episode, and do join me in a fortnight's time where I'll be talking more about mental health in the workplace for Mental Health Awareness Week, or as we always do on the podcast, Mental Health Awareness Month. Until then, everyone, take care and bye for now.
Thanks for listening to the Diverse Minds podcast. Don't forget to subscribe on Apple Podcasts, Spotify, or wherever you access your podcasts from. You can also connect with me on Facebook and LinkedIn. Tune into next week's episode of the podcast, where I'll bring you more insights on mental health and inclusion. Bye for now.